Massachusetts prison population has declined in recent years, but prison spending is still on the rise.
22 News I-Team reporter Tamara Sakarzik crunched the numbers to find out why.
Nearly 20% of Massachusetts inmates are over 55. The 22 News I-Team discovered older inmates generally lead to higher health care costs.
He was terminally ill. He was permanently incapacitated. He couldn't feed himself. He couldn't get out of bed.
Massachusetts has a lot of sick and elderly inmates. The 22 News I-Team discovered the state has one of the country's oldest prison populations. Nearly 1,600 Massachusetts inmates are over 55. The state's oldest inmate is 95 years old. 31 inmates require help eating and getting dressed. Medical conditions range from cardiac issues to cancer, and taxpayers are footing the bill.
I can't understand what the value to society is of keeping people locked up who are permanently incapacitated and about to die.
The I-Team went to the State House to see what your lawmakers are doing to bring down costs. Cambridge State Senator Patricia Jelen helped write the provision that allows physically or mentally incapacitated inmates to apply for compassionate release, which provides the option of going into a nursing home covered by Medicaid or private insurance.
We get 50% federal reimbursement if a person is not incarcerated. So when they go to an outside nursing home, we save half the cost of medical care as well as the cost of incarceration.
The state doesn't track health care costs for individual inmates, but the I-Team discovered it cost taxpayers $283,000 for 1 year at the Shattuck Hospital Correctional Unit in Shirley. Health care costs are also a burden for county jails. Massachusetts has one of the oldest prison populations in the country, which has driven up the cost of health care. Here at the Hampden County Jail in Ludlow, a majority of their expenses come from inmates who are suffering from substance use disorder. How much does the jail spend for health care costs per inmate every year?
Per inmate in fiscal year 18, the most recent fiscal year, was $6,700.
Sheriff Nick Kochi told the I-Team 85% of Hampden County inmates suffer from substance use disorder or other serious health conditions.
We have a very acute population of very seriously ill people that are coming to our custody. It's taking a lot of resources to get them the health care that they need.
The Hampden County Jail cuts costs by shopping for the most affordable prescriptions. While compassionate release may be an option for some of the state's sickest inmates, it's still unclear whether any nursing homes would be willing to take them in. To qualify for compassionate release, an inmate needs to be permanently incapacitated or have less than 18 months to live. The parole board ultimately makes the final decision. So far, no Massachusetts inmates have been granted compassionate release. I'm Tamara Sakarzik, working for you with the 22 News I-Team.